Good day, sir. My name is Renel T. Plaza from BSN 3A. Today, I'll be discussing the research that I've chosen entitled Folk Medicine in the Philippines, a phenomenological study of health-seeking individual by Nadine Angel O. Rondilia et al. From International Journal of Medical Student 2021. Personally, as a cultural performer and as the Vice President of SPC Cultura, I have learned how deeply our tradition and beliefs are woven into our way of living. Culture is not only expressed through dances, songs, and stories. It also present in how people heal, take care of themselves, and make sense of their well-being. This is the reason why I choose this study about the practice of folk medicine in Quiapo, Manila. Folk healing is a living example of how our identity, faith, and heritage continue to guide everyday decisions. By understanding the experience of people who use folk medicine, we also begin to understand how culture shaped the Filipino approach to health. So first, let's talk about the nature and the scope of the paper. The paper focuses on the practice of folk medicine in Quiapo, Manila, specifically on the people who visit the area to seek traditional remedies for different health needs. Quiapo is known as a place where religious beliefs, culture, and healing practice blends together, making it an important site of studying Filipino traditional medicine. This study explored how culture, tradition, and personal beliefs influence the way Filipino makes decisions about their health. It showed that many people continue to rely on remedies passed down through their families or learned from their communities because these practices are already part of their identity and way of life. Although the research involved only 7 individuals, these personal stories and experiences provide valuable insights into the deeper reason why folk medicine remedies important, trusted, and practiced today. This limited number does not less the value of studying. Instead, it's also a closer and more meaningful understanding of their belief, motivation, and healing experiences. Next is for the objectives and purpose of the study. The main purpose of the study is to understand why some individuals choose folk medicine either in place of or alongside modern healthcare. The study aimed to discover the meaning behind their health choices and the reason why they specifically go to Quiapo to seek healing. It also seeks to describe how the participants views the effectiveness and significance of folk medicine in maintaining their well-being. By learning about their thoughts and experiences, the study hopes to show that health decisions are influenced not only by physical needs, but also by emotion, family tradition, culture identity, spiritual and physical history. The goal is to deepen our understanding of how people interpret health and healing in a way that includes both science and culture. Next is for the research method. The study used a qualitative research method called phenomenological, which focused on understanding the living experience of people. Instead of using numbers or statistics, this approach listened closely to the personal stories and described the meaning behind those experiences. 7 individuals who personally brought folk medicine in Quiapo were selected and interviewed one by one. Their conversation were recorded, viewed and analyzed carefully. The researcher um, identified patterns in their response and group similar ideas into themes. This allowed the study to highlight what the participants have in common and as well as what makes their experiences unique. Through this method, the researcher was able to capture the emotions, beliefs, and cultural influence that shape their health decisions. Next is for the findings of the study. The study revealed three major findings. First, the theme of health-seeking behavior. Health-seeking behavior showed that people go to Quiapo because they believe they can find healing there, whether for physical illness, emotional struggles, and spiritual concerns. They go not only for medicine but also for hope, connection, and comfort. Second is for the theme of source of knowledge. The theme source of knowledge shows that most participants learn about folk medicine from their families, friends, and communities. These practices were passed down from older generation and became part of their daily living. This means folk medicine is not just a treatment, it is a cultural heritage. Lastly, the theme of folk medicine use described for specific remedies they rely on, such as herbal plants, oils, and other natural products. The participants strongly believe that these remedies are effective because they have seen or experienced result themselves. Lastly, implication of the findings. The finding shows that many people continue to trust folk medicine because of cultural traditions, personal experience, affordability, accessibility, and sometimes uncertainty about modern medical treatment. These beliefs are meaningful and cannot be ignored. For us as future nurses, this study teach the importance of culture sensitivity and respect. If we want to provide truly holistic and compassionate care, we must recognize our patients' health decision and influence by their upbringing culture, values, and living experience. Instead of judging or discriminating traditional practice, we should seek to understand them and when appropriate, integrates them with modern healthcare. This approach helps build trust and better communication between patients and healthcare providers. The study also suggests that future research should include the perspective of folk healers themselves, as their knowledge and experience could provide a fuller understanding of how folk medicine continue to be practiced today. In conclusion, this study reminds us that health is not only about medicine, but also about culture, beliefs, and personal experience. Folk medicine continue to survive because it holds meaning for the people who use it. As a future nurse, we should respect this practice and understand where our patients are coming from so that we can give care that is thoughtful, compassionate, and culturally aware. Once again, good day, sir.